Good afternoon. My name is Dr. Carlos A. Smith. I am the Medical Director of Humanitarian Medical Clinic. I'm a board-certified emergency medicine physician. I've been practicing emergency medicine in the Tampa Bay area since 2005. It's been 15 years. I actively take care of patients who have COVID-19. Whether they're very critically ill or even the minor ill, I'm daily involved in the care of these COVID-19 patients. Sure. So COVID-19 is actually the syndrome or the disease that is actually caused by the SARS-CoV-2 virus. The SARS-CoV-2 virus we know originated in China in the latter part of 2019. This is why it's called COVID-19, because that 19 signifies the year 2019. So the SARS-CoV-2 virus that came from China into the West Coast and really got into the Northeast as well has caused this pandemic known as COVID-19, this disease that we're all living daily. Sure. So I think that's a great question. The pandemic has changed a lot of the ways that we think, that we act, how we work. This whole social distancing and really quarantine has been needed. It's because this is a communicable disease. The SARS-CoV-2 virus is a communicable disease causing the COVID-19 syndrome. We have had to socially isolate. We've had to quarantine. We've had to cover up. We've had to be very diligent with our hand hygiene. So I think it's something that we've all experienced on a daily occasion, all the changes that this society, as not only in the United States, but worldwide, that we're seeing every day. And it's going to be really interesting to see how, going forward, how we adopt those same distancing, hand washing, PPE. But for right now, this is absolutely needed for us to control the spread of the COVID-19 SARS-CoV-2 virus. Well, and I think that's a great question. What we need to do is we need to learn from this, right? We don't want to make these same mistakes twice. We don't want history to repeat itself. So it is absolutely necessary. It is of the utmost importance for us to understand not only this pandemic, but where did we fall short as the pandemic started really reaching its peak. So I think when this is all kind of said and done, if you will, we'll all kind of sit back, scientists, public health advisors and specialists, infectious disease specialists, physicians as a whole, we'll all sit back and say, what did we do right? What did we do wrong? What can we do going forward? I think on a daily, you're going to really see a lot more PPE prevalent, not only in the hospitals and the clinics, but also out and about, at the airports, at the grocery stores. And I think it's very important. And I think if we all stick with this plan of, maybe covering up, being conscientious about the spread of disease, hand washing, maybe a little bit of social distancing, I think we're gonna actually maybe even see some relief in some of the infectious disease that we see yearly, like common cold, like influenza. We may see a little bit of a drop in it if everyone maintains these kind of semi-quasi PPE. And I think this is a really good point, because I really want to underscore the importance of everything that we've been saying. We've been talking about social distancing. We've been talking about hand hygiene. We've been talking about PPE. And I think this is a great point to drive home, because it's not, I've said this already to my friends in the general public. I'm an emergency physician by education, by board specialty, by practice. And obviously I have seen the very critically ill with COVID-19. I've even seen the patients with COVID-19 that are actually have minor symptoms. After all of this time, after more than 3 or 4 months into this, I have tested negative all throughout. And why is it that I've tested negative and stayed healthy? Because I stick to the PPE, I stick to the N95, I stick to the social distancing as much as possible, I stick to the hand washing. So I really want to underscore the importance of really trying to follow those, not only recommendations, but they really are the way to stay healthy. Obviously, nothing can be 100%, but I am living proof that after 4 months of being in the emergency department with critically ill COVID-19 patients, I still remain negative and asymptomatic. So as a practicing emergency physician, I've had multiple opportunities to not only treat COVID-19 patients, but also talk to them about their disease process. And through this, I've become very educated on all of the pathophysiologic problems of COVID-19 and current treatments. And with that, I welcome any questions or comments that may come of the SARS-CoV-2 and the COVID-19 disease. So, we always have to be very concerned about the well-being of our senior citizens. We know that they tend to have a lot of comorbidities and medical diagnoses that may put them at an increased risk of a serious COVID-19 infection. And with that in mind, our elderly, our senior citizen population tends to be has to be a little bit more socially isolated. We know about the nursing homes and the assisted living facilities that they have really shut their doors to their family members and friends, and obviously that takes a psychosocial kind of it takes a social toll on their mental well-being. So we do have to take this population into consideration, but we also want to make sure that they are living as fulfilled life as possible. Sure, so I think this is a great question. I mean, anytime we have loss of life, especially as an emergency medicine physician, it's hard. I mean, we really pride ourselves on saving lives and maintaining life. And so when we are faced with just another disease like COVID-19 that has been responsible for so much morbidity and mortality, it's just something else that is up against us as physicians. So we're used to taking care of critically ill patients, but this is just something else now that we have to deal with. And unfortunately, we still don't have all the answers. We don't have a full understanding of not only the virus, but of also the disease process of it. So a lot of times it's very frustrating when a COVID-19 patient passes away in front of us because we feel that there's more that we could have done. But I feel, and I really know that in the years ahead, we're going to have a better understanding of the SARS-CoV-2 virus. We're going to have a better understanding of the COVID-19 disease and syndrome, and we're going to have better understanding about the proper treatments and how to take care of these patients. I'm convinced that we will have vaccines, and I'm convinced we will have medical therapies directed towards the SARS-CoV-2. I am certain, I know, I feel very confident that in the months to come, if not the years to come, we will have a vaccine against the SARS-CoV-2 virus. And then I'm convinced also that we will have medical therapy against COVID-19, the syndrome that we all know. I am confident here at the Humanitarian Medical Clinic that we will provide world-class medical care for you and your family members.